Hi, it's David Liew here on the last day of EULAR 2023 for Room Now. Been covering a lot of great rheumatoid arthritis stuff, but the one thing that's been basically casting a massive shadow over this meeting is, of course, the fallout from oral surveillance, which we're still trying to process. Regulatory bodies have made decisions here in Europe. The EMA recently made a decision across the JAK inhibitor class for autoimmune conditions. We actually had a really good session with the EMA, which is a traditional thing here at EULAR, but where they discussed a little bit of the process that followed that. It wasn't just the oral surveillance, it's beyond that, going to some of the baricitinib real-world data, which got them to look into whether maybe the JAK inhibitor concern was really a class problem. And so this really brings up the question about real-world data, because that kind of the regulatory warning has real impacts. We saw that in the PSA recommendations today, the EULAR PSA recommendations, that JAK inhibitors are no longer on the same level as the other targeted therapies because of the regulatory warning. And that's all, once again, because of this real-world data. Now, we have seen a number of different sources of real-world data here at the meeting. We've seen French real-world data, we've seen South Korean real-world data, we've seen Dutch real-world data on cardiovascular disease with JAK inhibitors, more on cancer in real-world data from related to JAK inhibitors. So how are we meant to process all this? Well, I'd just really like to say as well that I think we've got to think about whether all the limitations of these real-world data. Of course, much of this has been discussed in terms of the population that you select, possibility of channeling bias in amongst us all, and how JAK inhibitors have been rolling out into the market. But I think a critical thing, which is perhaps under-discussed, and which came up on the poster floor today from some of the French registry data presented or collated, sponsored by Pfizer, was actually really just about the duration of follow-up. It bears remembering that certainly for cardiovascular disease, but definitely for cancer, small, short exposures are not what's going to lead to the cancer or cardiovascular risk. It takes time for these things to emerge, it takes time of exposure, but then potentially also time after that period in order for us to start to see that play out in actual incident events. And so, in fairness to the Pfizer poster, they pointed out that their follow-up from French real-world data was only 11 months and that we needed to see more after that. And I think that's true for all of the data that we think about epidemiologically. We've got to think about plausibly, from a biological plausibility point of view, how long is it going to take for that manifestation to play out in practice? For all the stuff about JAK inhibitor safety, about rheumatoid arthritis as well, and plenty more from this great meeting, you know where to go, roomnow.com.